Hey guys, today we're going to talk about a condition that happens a lot. It's often misdiagnosed. It's often kind of like the throw it against the wall and let's blame this when it may or may not be. And that is fibromyalgia. It's a chronic disease which causes pain and tenderness throughout the body, not just one area, as well as general fatigue and insomnia. Now, they really don't know what exactly causes fibromyalgia, but what they've seen is it's a heightened sense of pain that these certain individuals have that others don't have. There is no cure for it, unfortunately. All you can do is manage the symptoms. The sensitivity to pain occurs throughout the whole body. And women get it more often than men. It can happen to any race. It can happen at any age. Kids can get it as well as senior citizens, but it's most oftenly diagnosed during middle age, and then your risk increases as you get older. It has been linked to people that have mood disorders such as anxiety, psychosis, depression, as well as patients that have chronic pain or autoimmune diseases, so like rheumatoid arthritis, IBS, lupus. If you have those, you're going to be more prone to get a diagnosis of fibromyalgia as well. It does run in families. However, you sometimes out of the blue can have an individual that comes up with it when no family members do. But if you do have a family member with it, a direct in line like a father, mother, grandmother, grandfather, you would be more likely to get it than somebody that does not have that. As far as symptoms, what you can see is chronic, widespread pain. So it's not just like in your joints, which would be something like arthritis or gout, but it's all over in the joint as well as the muscle, as well as just in the skin. It's an aching, burning, throbbing type of pain. As well as you'll see generalized fatigue, the feeling of being totally overwhelmed, and the lack of ability to go to sleep. Some other things that you'll see is muscle or joint stiffness and tenderness. You can be tender to the touch. So where some people, especially diabetics, may not feel the touch when you touch especially their feet, people with fibromyalgia, just the slightest touch, they'll feel it and it can even be painful to them. You can see numbness or tingling in your feet or your fingers and your hands. You can see digestive issues such as bloating or constipation. And then something that's kind of weird, but it does fall into line with the sensitivity to touch that you will see, is patients with fibromyalgia will have a sensitivity to temperature, to light, to odors or smells, and to noise. So noise that may not bother you and me, for somebody with fibromyalgia, just a little bit of noise like going into a busy classroom will just set them off. It's too much for them to handle. Something else that occurs a lot with fibro patients is called fibro fog. And that's where you have difficulty concentrating on tasks at hand. You have difficulty thinking clearly, and you may even have some memory issues because of that. And they've linked that back to fibromyalgia. Again, I said the cause is unknown, but they have linked some to genetics. They've also linked some to environmental factors that can go on. So just like I said, if you have a family that has a history of fibromyalgia, sure, it could be in genetics, but if you think about it, if you all lived in the same house or in the same community, maybe there's something in that house or in the community going on that sets off this fibromyalgia. Infections, serious infections, they question whether that can also be linked to causing fibromyalgia, as well as a lot of cases, especially in middle age, they've traced back to a significant major event that occurred, like a physical traumatic event, surgery, maybe going through cancer treatment, or even an emotional traumatic event like maybe the death of a spouse. That has been, they found to be linked up to maybe the start or onset of fibromyalgia in a lot of patients. As far as complications that you can see with this, first off, because of what you're going through when you have fibro, with the pain, the difficulty concentrating, it can cause difficulty in just your well-being and your lifestyle. So you really need to look at doing something like counseling. Counselors can be a wonderful source to help you deal with fibro. The other thing is, of course, because of the pain that you're going through, because of the lifestyle difficulties you're going through, you're going to be a candidate for having depression. So you want to talk to your provider about that, because there are things that you can get on, like SSRIs or selective serotonin reuptake inhibitors, like Zoloft or Prozac or Lexapro, that can help out with the depression as well as help out a little bit with the pain too. For treatment, you can look at things like over-the-counter pain relievers, Tylenol, ibuprofen, Aleve, naproxen, if you don't have any heart or bleeding issues or liver problems. Then duloxetine or generic Cymbalta has been used to treat fibro, as well as helping out with some of the depression that can be related to that. Savella is one that's been approved to treat fibromyalgia. They have used amitriptyline, which is a tricyclic antidepressant, to help with the sleep, pain, and depression associated with that, as well as Flexeril or cyclobenzaprine has been used to help for sleep. Gabapentin or Neurontin has been approved, as well as Lyrica or pregabalin, to treat the pain and the spasm that can occur with fibromyalgia. Something else that you can look at that's not medication related is physical therapy and occupational therapy. They can do wonders with you as far as being able to get some of the flexibility back, to be able to deal with some of the pain. If you exercise and stretch on a consistent basis, stretching daily, that will help with some of the joint tenderness, some of the muscle aches and pains that you will get, as well as release some dopamine, which will help with your depression that can occur with fibromyalgia. You need to remember to pace yourself. Even though you got a lot going on in your life, if you overdo it one day, with fibromyalgia, you may pay for it for 2 or 3 days after. So learn to pace yourself. Also, make sure you're eating healthy foods in healthy amounts with a healthy diet. If you eat garbage, garbage in, garbage out. So make sure you're eating healthy and getting a lot of water. If you're a smoker or a chewer, stop, because that is not good for patients with fibromyalgia, as well as a lot of caffeine. If you're drinking a lot of caffeine in coffee, tea, energy drinks, cut back on that. It will help you out. And then remember to do something every day. Fun. It'll improve your mood. It'll improve your outlook. But it just is good to get out in the sun and do something like that. They have found out that the treatments of acupuncture, massage therapy, and regular visits to your chiropractor can also aid in dealing with the symptoms of fibromyalgia, helping with the outlook on just improving your depression that may occur, improving your flexibility that can occur, and adjusting to the pain and just the sensitivity that can occur with touch that happens with fibromyalgia.